Hello everyone, in this video I'm gonna explain how to differentiate between lung cavitation and cyst. So first thing, we're gonna start with definitions of each one. So pulmonary cavities are thick-walled abnormal gas-filled spaces within the lung, and they are usually associated with a nodule, mass, or area of consolidation, and also a fluid level within the space may be present. And the lung cyst is gas-filled structure with a thin perceptible wall, typically under 2 millimeters in thickness, but can be up to 4 millimeters. And the diameter of the lung cyst is usually under 1 centimeter. So, as I said, both lung cavities and cysts have in common gas-filled structure, but a lung cyst can be distinguished from a cavity for which the wall thickness is greater than 4 millimeters. Then we're gonna talk about causes and differential diagnosis of lung cavities. So pulmonary cavities may be a result of malignancy, infection, or inflammation. And as we can see, malignancy, for example, cavity in pulmonary metastasis or primary bronchogenic carcinoma, squamous cell carcinoma, sarcoma, and etc. For the case of infection, we can have pulmonary tuberculosis, cavitating pneumonia, and so on. Then for inflammation, we can have rheumatoid nodules or granulomatosis with cholangitis. Then for the differential diagnosis of lung cavities, we have lung abscess like TB, lung cancer, septic embolus, fungal infection, and granulomatosis with cholangitis. And here we have some cases of lung cavities. As we see in the first image, a well-defined thick-walled cavity lesion noted in the right parahilar area in the right midzone of the right lung. And this is a case of pulmonary TB. And on the second picture, this patient had a previous history of coronary artery bypass graft surgery. As we note that the sternal wires and clips are there, and we see also well-defined cavitary lesions in the right upper lobe, and in such case it is lung cancer. And here we have another case where we have frontal and lateral views which show a thick-walled right upper lobe cavity lung lesion with air fluid level. And in this case, the patient is represented with upper lobe abscess of right lung. And next, we're gonna go for lung cysts, causes, and differential diagnosis. So, starting with causes, we have primary pulmonary disease and acquired cystic lung disease, where the primary pulmonary disease is where diffuse cysts are the predominant features. And we have pulmonary Langerhans cell histocytosis, lymphocytic interstitial pneumonitis, neurofibromatosis type 1, and so on. Then for the acquired cystic lung disease or the cyst as a secondary feature of the primary disease, we have honeycomb and unusual interstitial pneumonia pattern, sarcoidosis, light chain deposition disease, and etc. Then for differential diagnosis, so if the pulmonary lucencies in question are not true cyst, not thin-walled airspace, there are several considerations other than cystic lung disease, like cystic bronchiectasis, which is connected to tubular airways, centrilobular emphysema, where without distinct walls, and cavitating lung lesions, where the wall thickness is more than 4 millimeters. And here we go with another cases of especially for patients with lung cysts. So we're going to start with the right image where we have a hyperflated lungs with some multiple thin-walled cystic spaces in the right lung, and several have air fluid levels in the dependent position. And then we move to the left images where we have X-ray image accompanied with CT for more clarification. So this image, X-ray image, it shows some hyperinflated lungs, cardiomegaly, and also the bronchial wall is thickening and dilated cysts. And according to the CT, we notice that cysts are filled with fluid. And all these features are related to cystic bronchiectasis in severe state. And I'm gonna let you down in the description the link of the video to get more clarification about bronchiectasis. Thank you.